Welcome to another in our series of videos addressing chronic disease in the workplace. I am Dr. Brian Williams, a primary care physician and specialist in injuries and illnesses in the workplace. In this video, I will be talking about hypertension, a chronic health condition that's already very common, and one that is going to become increasingly important to workers and workplaces in the coming decades. I will also give tips on how employers can support employees with hypertension to optimize their skills, experience, loyalty, and quality of life. Hypertension is an extremely common problem, affecting more than 40% of all aging workers. This makes it the second most common chronic disease for workers 55 and older, behind only arthritis. So what is hypertension? It is a disease most people have heard of, but can be confusing. I'll start with a brief introduction. Hypertension has nothing to do with being hyperactive. Hypertension means high blood pressure, and is often referred to this way by medical and non-medical people. It should not be confused with high blood sugar, which is called diabetes, although the two diseases can commonly coexist. Blood pressure readings have two important components, represented by two numbers. The top number is the systolic number, which is measured as the force pushing against the artery walls as the heart contracts or beats. The bottom number is the diastolic number, the force against the arteries as the heart relaxes. High blood pressure is dangerous because it damages arteries. One way to think about hypertension's effect on arteries is a garden hose. Garden hoses wear out due to environmental stressors like the sun, as well as normal wear and tear through use. If the hose is under enough water pressure, it could burst, especially if there's a section that's worn or weakened. This number as a blood pressure reading would be reported as 140/90. These are important numbers to know because these are the numbers that physicians use to determine whether someone has hypertension. Each marks the cutoff for hypertension in most people. Sometimes blood pressure goals are even lower for people with other medical conditions. If either number or both are consistently high, by definition on 3 separate occasions, then hypertension is diagnosed and treatment begins. Lifestyle changes are the first and most important interventions and will be discussed in more detail later. Hypertension is truly a silent killer. This means that for many people, the damage is done without warning symptoms. Many people die from the effects of hypertension without ever knowing they had the disease. Cardiovascular diseases like heart attacks and strokes are much more common in those with untreated or undertreated high blood pressure. Most people with hypertension feel perfectly normal, and signs related to hypertension are rare. This means unless you look for hypertension, you won't know it's there. Unfortunately, high blood pressure becomes more common as people age. This is why doctors' offices check blood pressure readings on every patient at every visit. The problem here is that because people with hypertension feel well, they may not be getting regular checkups. I think it is also important to point out that there are two kinds of hypertension. The first is by far the most common, called primary or essential hypertension. This is the type of hypertension that tends to come on slowly over time and does not have any discernible cause. In fact, one of the reasons it is called essential hypertension is that early physicians saw it so commonly in the aging population, they assumed it must be essential to survive. What we now know is that it shortens lives because of its impact on blood vessels around the heart and brain. The other type of hypertension is called secondary hypertension because it exists secondarily to some other condition. This form of hypertension is often correctable by addressing the underlying treatable cause. Any diagnosis of hypertension should consider such causes, but they are much rarer than primary hypertension. To me, this distinction is important because some people assume that hypertension develops only in those who are overweight or smoke or never exercise. And while these are risk factors for developing high blood pressure, anyone can have the disease. The fact is, primary hypertension is part of some people's genetic blueprint and will require medications to treat. So if hypertension is a personal medical problem, what can employers do to help? Employers should consider that helping workers with hypertension avoid downstream medical problems will make those workers more productive in the long run. Employers can encourage or even incentivize annual wellness visits to primary care physicians. Visits to PCPs are one of the most common ways for people to learn that they have hypertension. Additionally, Both safety and wellness programs can help employees better manage their hypertension. Helping these programs work together is key. Wellness can also mean changing the physical job space to promote safety and health. By the time workers reach age 55, they should be seeing a personal physician every year, even if they are totally healthy. This is because some diseases like hypertension develop slowly over time. These visits are for maintaining health. Plan to use these visits as a time to review family medical history as well, since this is a major risk factor for hypertension. As I've mentioned, anyone can develop high blood pressure, but workers who are overweight, smoke, and are sedentary are more likely to have hypertension. These are things that primary care doctors can help modify, and work sites can support these efforts. Classically, safety programs are designed to protect workers from known harm. These same measures can sometimes help reduce the burden of chronic disease. For example, some studies suggest that occupational noise can raise blood pressure and increase the risk of developing hypertension. Therefore, safety programs designed to reduce noise to protect hearing may also help blood pressure. Another intervention that employers can offer is to screen blood pressure for their employees. This can be done with on-site occupational medicine clinics, trained staff, volunteers, or with mass screenings during wellness fairs. Wellness managers promote healthy lifestyles through fitness activities and dietary modification using worker education. Dietary measures can help with weight loss and also with limiting salt intake, which is important for most with hypertension. Smoking cessation programs offered directly through the employer, through employer-based health insurance programs, or subsidized by the employer can also control a considerable risk factor for cardiovascular disease and hypertension. Lifestyle interventions like encouraging weight loss can also help overall health and well-being, and also create a safer work environment. Organizations are encouraged to have both a safety officer and a health and wellness manager, who work together and are able to offer a coordinated response to health and safety concerns. The more closely connected these programs are, the more benefit the worker sees. Maintaining activity is a key component of hypertension management. Dedicated exercise is one of the best ways to do this. Exercise may help combat obesity and being overweight, but many people see benefit with blood pressure control even without weight loss. As I mentioned in my video titled Arthritis in the Aging Workforce, for most Americans, work is not exercise. If workers do not have access to an exercise facility on site, then supplementing gym memberships can go a long way to maintain the health of workers with hypertension. Worker stress has been shown to increase blood pressure and may lead to hypertension. This stress can be due to job task demands, conflict with coworkers or management, or even noise. Employers should actively work to resolve worker conflicts, address worker needs, and improve communication across all levels of employees. In this way, human resource managers and employees' direct supervisors are important team members in preventing the consequences of hypertension. Some employers provide stress management interventions through employee assistance programs, but organizational changes that reduce stress produce the longest lasting benefits. It's also worth noting that avoiding conflict, improving communication, and reducing noise levels are good for workers of all ages, as well as for organizational performance. Additionally, work sites can also promote smoking cessation by creating smoke-free campuses. When employers help workers better manage their hypertension, overall medical costs are likely to improve. There are also important potential gains in productivity and product quality, with reduced absenteeism, lost time, disability, and work comp claims. If a manager has a heart attack due to uncontrolled high blood pressure, then not only has the individual suffered a major medical event, but productivity for the whole team declines. When employers care about the health of their workers, employee loyalty improves, as does worker quality of life. Thank you for your attention. If you haven't viewed the other videos in this series, I would encourage you to do so. Employer groups of all sizes have help. The MAP-ERC is a NIOSH-funded research entity committed to worker health. NIOSH also provides guidance for worksite wellness and safety program integration through the Total Worker Health Program.